Bacteria and viruses are always present, and they spread faster with the change in weather. With the rainy season upon us, we have to do what we can to protect our families from seasonal diseases that range from the flu to waterborne diseases such as cholera and leptospirosis to even vector-borne diseases such as dengue. On this episode, we'll discuss preventive measures for these rainy season diseases and the flu. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. With us today is Dr. Alexander Huson, an infectious disease specialist from the Binyan Doctors Hospital and the Philippine Society of Microbiology and Infectious Disease. We're also joined by Dr. Ana Sofia Victoria Salazar Fajardo, a family medicine occupational medicine specialist from Perpetual Health Medical Center Binyan and the national president of the Philippine College of Occupational Medicine. The Philippines is obviously a tropical country, but when the summer season ends, our bodies will need to adjust to the rainy season. Ria, why does our immune system weaken during this change, especially during the rainy season?
Our immune system is really used to the warmer temperatures, no? Since we're here in the Philippines, our climate is always warm and humid, and any change in extreme temperature can always weaken the immune system.
Now I'd like to ask Dr. Alex, during this rainy season, it's upon us already, what should our viewers watch out for? Ano yung mga diseases that should be prevalent or common ngayon na may change in temperature?
The most common diseases that we will be seeing during this season is the respiratory illnesses. So most common yung mga trangkaso or the usual flu that we encounter. Also, in the advent of rainy seasons, of course, may mga flooding. We also encounter dengue, leptospirosis. Also, some other foodborne diseases will also be more common during these days, like hepatitis or acute gastroenteritis.
Could you explain to us what is the connection of the colder weather? How does this aggravate the spread of microbes like viruses and bacteria?
Since maulan, mas malamig, and yung mga tao, usually they nagkukumpul-kumpul, mas malapit sila, will all be contributory to sa pagkahawa-hawa na, for example, yung flu or trangkaso. Kasi mas malapit, mas increase ang contact with other people, then yung mga communicable diseases will be more prevalent during the season.
According to the Department of Health, the common diseases during the rainy season in the Philippines include, aside from the respiratory diseases, they also include diarrhea, waterborne diseases such as typhoid fever, cholera, leptospirosis, and vector-borne diseases such as malaria and dengue. Now, let's first talk about diarrhea. Doc Ria, why is this very common, especially among Filipinos and also during the rainy season at that?
So, of course, we all know that the very common means of transmission for diarrhea is foodborne or waterborne diseases. And sometimes, if we do not wash our ingredients for our food properly, then, of course, it will be exposed to the bacteria and the pathogens in this raw food, no?
I'll ask Dr. Alex naman, let's talk about some of the waterborne diseases here. Among them is cholera, leptospirosis, and typhoid. Let's start first with typhoid, Doc Alex. Please explain to our viewers what this is and why should we be concerned about this?
Typhoid is caused by a bacteria called Salmonella. So maraming mga types ng Salmonella. And usually we get this from the oral fecal route. So nakakain natin yung bacteria which causes typhoid fever, or some medical terms will call it enteric fever. So usually focus sa yan or sa enteric system or sa gastrointestinal system wherein it causes prolonged fever.
Doc Ria, what about, let's talk briefly about vector-borne diseases naman. Please explain to our viewers, especially napaka-common na ngayon ang dengue.
Dengue, no, is caused by the mosquito, and around our house, no, sa ating bahay, pagka may naiipon na tubig, doon pwede po magkaroon ng breed, no, ng ating mga lamok na nagkukos ng dengue.
Now, Doc Ria, what about malaria? Pwede rin mangyari ito sa Philippines, yes. Pero bakit mas napakadalas ang dengue kesa sa malaria?
Ang malaria naman po, nakikita natin sa mga clean places, no? Ang dengue talaga po ay dati during the rainy season. Ngayon po ay all year round na po nakikita ang dengue sa ating mga pasyente. So, kailangan lang pong siguraduhin, laging malinis ang ating paligid sa mga bahay at ating sa mga trabaho.
And apart from what DOH listed, influenza, or commonly known simply as the flu, also occurs all year round. Doc Alex, why is the flu equally as concerning as other rainy season diseases?
Kasi very communicable siya, masyado siya mabilis makahawa simply because yun nga, it's being spread through respiratory droplets. So para siyang COVID. Pag-ubo, pag-sipon, and pwede siyang mahawa through droplets and also contact. Also, very common na magkakos ito ng debilitating headache and body aches that will impair yung functionality ng patient na magkakaroon ng flu.
Now, we'll talk more about the flu and how best to prevent it later on in the show. But there are a number of illnesses to watch out for, especially during the rainy season. When we return, let's find out who are vulnerable to diseases in the rainy season and how best to manage them. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. Earlier on the show, we discussed what the most common rainy season diseases are in the country. Now let's talk about who are prone to these infections. Now, as we approach the latter half of the year, people are more likely to leave their houses to work than before. Now, this also includes children returning to school as we slowly return to face-to-face classes. Let's talk more about who are the most vulnerable during this rainy season. Doc Ria, is there a specific age group most likely to get sick, lalo na ngayong tag-ulan?
Our seniors, those who are 60 and above, and our children as well, no, the very young. We would like to also consider the most vulnerable, those adults or those patients who have immunocompromised conditions or yung mababa ang kanilang resistensya.
Is there any connection kung bakit ang mga senior citizens, bihira sila actually magkasakit, pero kapag nagkasakit sila, it is more likely na mas matindi ito, kumbaga trangkaso talaga. Why is this so? What should our senior citizens watch out for really? Please advise them para mas maintindihan nila.
As we age, the normal defenses of our respiratory system, no, yung meron kasing nagpo-protect sa ating respiratory system during our younger years. But as we age, etong mga defense mechanisms na ito ay medyo bumababa na ang kanilang function. So the more that we should be careful na hindi po tayo magkasakit, and because the more that they are prone to other diseases, other respiratory diseases such as pneumonia. And this is why we would like to encourage all of our senior citizens to have their flu and pneumococcal vaccination.
Now, Doc Alex, do you also have tips for workers who travel to and from their work, even students, especially those in university na madalas bahain?
Iwasan po natin yung mga possible sources of infection. So, it's a good thing that wearing mask is mandatory because of the COVID-19 pandemic. So, that piece of cloth, that mask will protect the mga estudyante, mga workers, na mahawa from other people who might have, for example, sipon, ubo, or mga flu, trangkaso.
Now, Doc Alex, pag-usapan natin the vector-borne diseases, especially dengue. Binanggit ni Doc Ria na talagang dito sa mga cities, no, big cities, mas common talaga ang dengue. How can we protect ourselves, lalo na sa mga mosquito bites?
We have to remember that dengue mosquitoes are day-biting mosquitoes. So, usually, if you go into work in the morning, if you go to school sa morning, dyan yung sila makukuha. Pwede po natin, syempre, kung nasa office work tayo, try to look for the breeding places of mosquito. Most common dyan yung mga stagnant water. Check the area kung meron mga flower vases, mga baso na hindi na merong stagnant water, yung nakatingga lang na tubig, and you have to dispose of them.
Now, Doc Ria, tell us what basic medication should we have inside our medicine box during the rainy season? Should we stock up on antibiotics, Doc Ria?
So with regards to antibiotics, I would advise our viewers to please consult your doctors first before buying your antibiotics. But some of the common medicines that we should have at home are paracetamol, probably some cough medicines, some medicines to also address your runny nose or your colds, no, yung para sa ubot sipon, and even for let's say a tummy ache, no, yung ating mga para sa sakit ng tiyan, just in case meron nga po tayong mga sakit tulad ng diarrhea.
Now, Doc Ria, pag-usapan naman natin ng nutrition. What kind of food should we be consuming, especially now sa rainy season? Food that will increase or make our immune system more robust.
So we should drink enough water every day, around 8 to 10 glasses of water or more if you are in a hot environment. And of course, we'd like to increase our vitamins and minerals through fruits and vegetables, and making sure that our diet is well balanced, no? Having the right amount of protein, calcium, carbohydrates in the food that we take.
Now, Doc Alex, let's talk about earlier on the program, we talked about typhoid, we talked about cholera. Please remind, especially parents of young children, how important it is to seek consult whenever they suspect na yung anak nila ay meron ito.
Yung common symptoms kasi nila for cholera, super dami na diarrhea that will cause dehydration. Also, typhoid naman will cause fever, prolonged fever, and late complications, pwede makaroon ng bleeding sa loob ng tiyan or ng intestine. So, very important magpa-consult po sa doctor po natin para mabigyan ng correct antibiotics.
So we've learned really a lot from both of our experts today when it comes to rainy day diseases. Thank you so much, Dr. Alexander Huson and Dr. Ana Sofia Victoria Salazar Fajardo, for sharing your insights about rainy day diseases. Coming up, we'll give you tips on how to boost your immune system against a year-round disease known as the flu or trangkaso, only here on MedTalk Health Talk. You're watching MedTalk Health Talk, and I'm Dr. Freddy Gomez. Now, throughout this episode, we've been talking about rainy day illnesses that we should all be wary of. Now, this includes the influenza virus, or more commonly known as the flu. Now, to combat the flu, we have vaccines that can protect us from these viruses. To tell us more about these flu vaccines, with us is Dr. Ana Ong Lim. She's a pediatric infectious disease expert and affiliate of the Philippine Foundation for Vaccination. Now, Doc Ana, we've learned that flu seasons vary all around the world. Now, here in the Philippines, Doc Ana, when should the flu vaccine be administered? When is the ideal time?
Rates of flu cases typically increase when the rainy season sets in. So usually by the time nagbabago yung panahon, June, July, August, and also towards the colder months of the year like the November, December, January, doon tumataas yung ating cases ng flu.
Tell us, what is the benefit ba of the flu vaccine, and how does it really affect our immune system?
Even if we think about it as a minor illness, parang trangkaso lang naman yan, pagpapahinga mo lang, meron din kasing mga pasyente na nagkakaroon ng flu with really bad outcomes. They end up in the hospital or their underlying illnesses become more complicated. This usually happens for those people who are in the senior population or those with comorbidities or those in the very youngest age groups. So we're interested interested in making sure that we provide them with protection. Paano naman yung mga regular adults na nagtatrabaho, maayos ang kanilang health status? It's important also for them to be protected kasi studies have shown that influenza disease can lead to a lot of absenteeism, and we also want to avoid that because that's the impact of that particular problem on our productivity.
Some people might be wary of vaccines in general. Now, as we've seen over the last 2 years with the COVID pandemic, marami talagang hesitations when it comes to vaccines. Can you explain the effectivity of flu vaccines and how they work? And meron ba talagang mga risks, kumbaga, ito sa katawan natin?
Flu vaccines, they're formulated on a year-to-year basis, Doc Freddy. Kasi ang ginagawa ng ating public health authorities, they do a surveillance of the types of flu viruses that are circulating globally, and then they will inform the vaccine manufacturers na dapat itong klaseng mga viruses ang tina-target ng bakuna ninyo. Actually, meron na tayong mga flu vaccines that basically been using the same structure as before. So matagal na ang safety and efficacy profile nitong bakunang to. When we talk about adverse events following immunization, typically these are the usual post-vaccination reactions like pain, swelling at the injection site, a little redness. May mga pangilan-ngilan, they'll really feel down after the vaccination, but that's not very frequently seen.
Can you still get the flu after being vaccinated?
I think in general, it's very important for our public to know na ang bakuna hindi naman niya pinapromise na 100% kang protektado. But it will really decrease the chances of you getting the illness. And in many cases, if you do get the illness, you'll probably get the more minor form.
Now, apart from vaccination, Doc Ana, we can also strengthen our immune system with proper nutrition as well as exercise. In the context of the pandemic, Doc Ana, how important is it to boost our immunity against the flu virus specifically?
Mas konti ang kalaban mo kung bakunado ka. So those who have been vaccinated against flu and eventually got COVID fared better. They had better outcomes compared to those who were unvaccinated. Boosting our immunity against COVID, of course, involves all of these measures that you mentioned. But of course, wag natin kalimutan dahil meron namang bakuna, why don't we benefit from these vaccines?
Can you share with us some tips on how to boost our immunity against illnesses, especially during the flu season?
The stuff that we remind people about to focus on during this pandemic, like physical distancing, wearing your mask properly, staying in well-ventilated areas, and hand hygiene are actually the same things that will help prevent influenza. Eating properly, engaging in exercise, sleeping enough every day is really going to help their general health and will help them resist lots of infections, including the flu.
Now, before we let you go, Dr. Ana, I would like to give you the chance to encourage our viewers to take their flu vaccines ASAP and let them know where can they get their flu shots, which is very important.
In the past 2 years, our focus has really been on COVID, but we should really not lose sight of all of these other vaccine-preventable diseases that we can avoid by being up to date with our vaccines. So I'd like to highlight influenza, lalo na we're already in the midst of the rainy season, and some of the infections that we think might be COVID can actually also be flu. So being protected will provide extra security and also, as I mentioned earlier, prevent these more complicated forms of COVID as has been shown in studies. So these vaccines are readily available for seniors. Our local government units have programs that provide them for free. And for other age groups, you can readily access these from your doctors, who will always know or usually have these vaccines available because it's really part of our routine schedule.
Thank you for being with us, Dr. Ana Ong Lim, and for sharing your insights and, of course, your expertise as well as your time. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.